Good evening, everyone. Let's wait for 2 to 3 minutes so that everyone can join, okay? Good evening, everyone. First of all, thank you for joining this meeting. I'm excited to welcome you to the Veritas School of Medicine AMC1 class, and I'll be your teacher for this course. And our first batch starts on March 30th, 2025. So in this class, we will explore about the subject and main themes of the course. And I believe in collaborative environment where everyone feels comfortable asking questions and sharing ideas and learning from one another. So feel free to DM your doubts, queries, whatever it might be, both academic or simply related to the course. Okay, so this is the most asked question about me and why I chose AMC over other country exams. So first of all, I completed my MBBS and MD from Ukraine, and I came back and I gave my FMG and AMC1 exam both in the same year. And I'm currently pursuing my internship in India. And why I chose AMC over other country exams is simply because first thing, it's a personal decision, and secondly, it's like I did my thorough research and discovered that Australia currently offers excellent opportunities for doctors, and ultimately it's a personal decision. And okay. So overview of the AMC1 exam. So the steps to follow is you have to do your ECFMG verification first and then the AMC portfolio creation and then the exam booking comes. First of all, you need to do your ECFMG verification and AMC portfolio. The step 1 and step 2 is must so that you continue to book your exam. Without the step 1 and step 2, you can't book your exam. And also, English exam is not compulsory to give before your exam. If you take PLAB or UKMLA, you need to give your English exam and then only you will be allowed to give your exam. In this, English exam is not compulsory. So to start your ECFMG process and booking your exams, like you start this process at least 3 months before your ideal date so that you avoid the last minute panicking. And the passing criteria, it's just 50 percentage. You have to take 250 out of 500 and it's just a pass or fail exam. You don't have to be a topper. Even if you're a topper and if your score is just 250, your both are still same. There's no difference, nothing. And what are the benefits of AMC exam? So there are so many exams across the countries. So what are the benefits of AMC exam that stands out? Globally recognized, and you can practice in Australia, and high salary and career growth. The salary somehow comes around like 1 lakh AUD annually, which is in Indian money, which is around 55 lakhs annually. And it's globally recognized and it's a faster pathway. Unlike PLAB or USMLE, it's a very long pathway. If you take USMLE, it takes like 7 to 10 years just to land on your first job. And it has a better healthcare system. And the pathway to PR increases chance of Australian permanent residency. And AMC1 was NEET PG and FMG. So if you take NEET PG and FMG, you have to cover 19 subjects based on Indian guidelines. But AMC1 is different. It focuses only on the clinical subjects, which includes ethics as an extra subject. Ethics is nothing but like how we have a community medicine, but we follow our guidelines. So ethics, they follow their guidelines. And it is based on Australia's most common cases. So for example, in India, we have TB and all. In Australia, TB is not so common. So they are not going to test that. And Australian guidelines and protocols differ from India. All the treatment, diagnosis, everything differ from India. So if you ask me like NEET PG and FMG coaching is enough for AMC, it is not. Because Australia is a developed country, India is a developing country. So the diagnosis, treatment, everything varies. Okay, and regarding the course structure and schedule. So the course structure and schedule, how we have planned is we are going to conduct 3 to 4 classes per week, which includes 2 theory classes and 1 to 2 MCQ based sessions. So, for example, in this week one, we are going to take GAT, which will be of 2 theory classes, and the third and fourth class will be GAT MCQ based sessions. And on Sunday or anything, like we'll conduct the weekly test also. So by that way, you'll be forced to study and keep tracking. And then the syllabus will be completed within 3 months, followed by 2 months dedicated solely to weekly test and recall exams. Recalls is nothing but what we call as PYQ, previous year questions. And if anybody has any doubt or like my voice is not audible or something, you can just comment. Okay, so theory classes. There will be 2 classes per week scheduled with consideration for working doctors, residents, and interns. So people who are working or residents or interns also can access to this class, and it is scheduled accordingly. And the performance evaluation, as I said, weekly tests will be conducted and a monthly mock test will be conducted. And a total of 2 full-length mock exams will be conducted as the final assessment. And also in the end, you'll get a chance for queries. We will have a proper Q&A session, okay? Okay, so what are the expectations and rules from our side is the classroom rules. Be on time, be respectful and kind, attend class using a phone or tablet or iPad, stay attentive and engaged, ensure a stable internet connection, and also, first of all, if you are attending this class, share the ideas and learn from one another. If 2 or 3 people are attending, we'll make a WhatsApp group so that you can discuss and do a group session together. So it will be very healthy environment and you can feel motivated. And of course, it should be a healthy group. Okay, so this is one of the most asked question, and I would say it's the magic mantra and secret. Don't tell anyone, okay? And I don't think so. Nobody is gonna say this or share this openly. Tips to pass this exam. First and foremost, believe in yourself and trust your hard work. And be consistent. Whatever you're doing, even if you feel like you're not doing good, just keep doing that. Trust me, you'll do good. And the pass rates of candidates are higher of those who take between July and November. That is exactly why we are starting a batch on March 30 so that our batch ends on August. So you can either give your exam in August, September, October, or November. And the pass percentage is like very high of those who give in the month, year end compared to the one who are giving in the year beginning. And the weekend exam slots tend to have a higher passing rate because so many repeated recall questions are coming for those who book their exams on the weekend. Okay, so there is a Q&A session now. You can either DM me. This is my WhatsApp number. You can either DM me, or if you are extrovert, you can just ask your queries here.
Hello.
Hello.
Ma'am, I had this query that right now I'm about to start my internship.
Okay.
So if I qualify this exam by this November, then till how many years or months is the result valid?
Okay, so the result is valid lifelong. You don't have to worry about that.
So I can easily take admission when I complete my internship, yes? Like after
Yes.
1 year or so.
Yes, it's valid lifelong.
Okay, thank you.
No problem.
Ma'am,
Okay. Okay. Yeah.
how many clinical subjects are there in this exam?
Total of 5 subjects. You can also follow our Instagram channel, like either the Hema Priya Srinivaslu or the Veritas School of Medicine, where we talk about the exam, how many subjects, and everything related to exam. And there are 5 clinical subjects here, which is, tell me the clinical subjects: OBG, medicine,
Surgery.
surgery, yeah, exactly, and then
Pediatrics.
psychiatry and ethics.
Hello, ma'am.
Yeah,
Ma'am, can you tell a little bit more details
also
about
pediatrics,
ECFMG verification? Like
ECFMG.
how much it costs and what is the process for it?
Okay, so basically ECFMG verification is nothing but we have to verify your degree. We, in the sense,
Mm.
the ECFMG, they have to verify your degree whether it is genuine or not. So they email
Mm.
your university and find out, okay, this degree is a genuine degree. And it costs around like 100 USD for your degree verification and 140 or 120, I don't remember exactly. Again, 120 USD. And then
Mm-hmm.
for AMC portal, it costs around like 600 AUD. This is not USD, this is AUD.
So we need to do both of these steps before the AMC one, right?
Yes.
And once it's like verified, like you don't need to verify it again, like after, like if
No, no, you
you,
don't have to verify it again.
like it's like just one time.
One time verification. Yeah. They just have to confirm whether your degree is like genuine or not.
Okay. Okay. Thank you very much.
Thank you.
Uh, Ma'am, only the clinical subjects are there, right? No
Yes, yes.
non-clinical. Okay,
No
thank you.
non-clinical subjects are tested. Only clinical subjects. If you take NEET PG or FMG, all the 19 subjects are being tested, and also ethics. Ethics is also tested. Ethics
Yes,
is like
ma'am.
community medicine.
Okay, got it.
Anybody else has any questions?
Hello, ma'am. Ma'am,
Hello.
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 how much is the part one exam?
Hello.
Sorry, your voice is breaking.
Ma'am,
How
actually,
much
I have a
is
doubt.
the
After,
one exam?
Can you?
actually, I have a doubt regarding
Mhm.
after AMC Part 1 examination. Like, what is your opinion on the jobs which they provide? I mean, are they sufficient enough right now? I mean, if we pass the exam and we can go there, are there sufficient enough of jobs for everyone? Because just like recently, I've heard that even Australia is getting saturated, but so I was little bit worried. Like, was that true, or is it okay to go? Or it's like that, yeah.
Okay. So basically, right now, if you take every country are saturated only, but Australia is currently better. And
Okay.
regarding the job opportunities, it is actually better compared to other countries. But as you said, your CV has to be strong because now everywhere the competition is high. So if your CV is good enough, even without any experience, you're gonna get your job.
Okay. And ma'am, like, can you please update in your like I actually follow you in Instagram. So can you please update on how to improve our CV, like,
Okay.
for this job opportunities and all?
Yeah, sure, sure. I'll
Yeah.
soon post a.
Yeah, thank you. Thank you. And
Yeah.
ma'am, one more thing is like, what do you think is the better approach for AMC1 preparation? Because I've already started it. Like, I'm doing
Mm-hmm.
this MedX and all. My exam is on June 20th. I've already booked it recently.
Okay.
So I might not be able to join for that March 30th program.
Okay, okay.
So what do you think, like, best books and all to, prepare?
You're just following Amedex, right? Just follow one resource.
Yeah, I'm just following MedX and Handbook for now. Like, I'm
Mm-hmm.
trying to complete both of them by March. So after that, I mean, what is your suggestion? What should
If
I
exam is
focus
in
on?
June, I think you should start doing your recalls rather than like running behind theory now because June is like very near. So I
Yeah.
think you should start doing your recalls.
Okay. And ma'am, how many months of recalls or years? Like, what do you prefer? How many months of recalls should we start? preparing like 6 months, 3 months? What is your opinion?
At least do 6 to 1 year, 6 months to 1 year.
Okay, okay.
Don't compromise on recalls.
Okay, and one more thing is, ma'am, like where do we get these recalls, ma'am? Like, should we pay for recalls in everything? Like, are there any free sites or free accounts where we can get?
Unfortunately, there are no free sites for recalls,
Okay,
but we do have a program where we only give access to recalls.
okay. Like, can we join in that program, ma'am? Like, only for recalls
Yeah,
instead
yeah.
of for
We'll.
the
I'll
theory
talk
and
to
all?
the. I'll talk to the group and I'll let you know. Support group and.
Okay, thank you, ma'am. Thank you.
Mhm.
Yeah, okay.
Hello.
Hello.
Ma'am, after our certificate verification, we need to give the exam, right?
Certificate verification in the sense you mean your degree verification?
Yeah, degree verification.
Yeah, yeah.
If I am giving the exam in next month, I am, for example, if I am giving my exam in next month,
Okay.
if I am unable to clear,
Okay.
again they will do all the certificate verification. Should I need to pay for that also?
No, you don't have to pay. And first thing,
Okay.
if you are not confident, I would highly suggest to join our course.
Okay.
Don't
Thank
because
you.
it's a very high amount. The fees is very high. So why do you want to think like suppose if I don't clear the exam? Better take a help from
Oh,
any course or something so that you will have confidence to crack your exam in the first go.
okay, ma'am. Thank you.
Anytime.
Ma'am,
Ma'am,
you
how
have
much
to
is
pass English
okay.
exam.
Sorry?
Ma'am, how much is
Hello,
the
ma'am.
AMC part one exam fees?
It's like 1,60,000 in Indian rupees. In AEDU, it's like 2 lakh something. I don't, it's 1,60,000 in Indian rupees.
Okay, ma'am.
Ma'am, you have to pass English exam.
No, no, no. You
What
don't
about
have to
IELTS?
pass your English exam to give this AMC1 exam.
After AMC1, we have to pass.
In case if you're applying for job, for the visa, you need to pass your English exam. Yes. But for the exam, it's not necessary.
I mean, what's the process of
How?
your visa after AMC1? Like, which visa we have to apply for?
You just have to apply for the temporary one. And then once you get a visa and all, moreover, once you figure out your job, the
Mhm.
visa will be sponsored by the hospital. So I don't think so visa and all is going to be a big problem.
Okay,
The
like,
main problem is first you have to clear your exam and give the interview and land on your first job. That should be the like your more concern.
like these whole things can be done from India itself, right?
Yes, yes.
And
Even
also, ma'am,
interviews can be given
mm-hmm.
online.
And ma'am, my degree is from Kyrgyzstan. It was 5 year course, so it's not any problem.
You have to check in the World Dictionary of Colleges whether your college is
Yeah, it's there.
it's there. Then it's not a problem. You
Okay,
also have to check the sponsorship notes.
okay. Yeah, because this time I finished my degree and cleared my FMG, so I'm waiting for the internship.
Okay, all the best. Congratulations also.
Yeah, thank you. And any suggestions like what things we can do during internship to make our CV strong?
That I'll post soon on my Instagram. Do follow me on Insta and Veritas School of Medicine. We'll
Okay,
share about it.
okay, ma'am.
That's a very big, so this won't be sufficient. That's why.
Okay, ma'am. And also, someone also asked that if they didn't cleared FMG, like, can they give this exam? And
Sorry?
someone also asked in the chat, like, if they didn't clear the FMG exam, can they give this without FMG?
Yeah, yeah, FMG is not required. You can give without FMG, with FMG, whatever it is. But FMG is not a requirement. Even if you don't clear your FMG, you can clear your AMC and you can get a job and go with it.
Okay, ma'am.
I know one of my seniors, she didn't clear FMG, but she did clear this AMC.
Mm-hmm. And what's the process for like residency after that? Like, how you go in that?
That is like you have to give your AMC2 or work-based assessment. That is again a very big story. So this session is only about AMC1. So I think like we can stick to it so that we cover everything regarding AMC1. CV
Okay.
and AMC2 and PG, everything comes after
Later.
this, right? So this session is only about AMC1.
Ma'am,
Okay.
can I ask you one thing? Can you please like explain about the course fees that you're providing here?
Okay, so the course fees and everything you can, there is a helpline here, numbers, you can text them and they'll be helping you. And this PDF will be shared to the Veritas School of Medicine WhatsApp channel and also on Instagram pages, so you can contact them. And also you can use code 24HR5000 within 24 hours to get a 5,000 discount on the total price and an additional 5,000 on registration.
Yeah, I also have another question. So you talked about the ECFMG verification, right? So do we have to be there in the university? Like, do we have to be an undergraduate to get the ECFMG certification from our university? Or do you want that the graduation certificate that we get from afterwards has to be verified from the college?
No, you don't have to be like, you just need your degree and your degree will be mailed to the university. You don't even have to be physically present there. They'll verify it themselves. Like we just upload our degree online and it's their business. They just email to our university and you have to, if you have your dean mail ID or WhatsApp number, whatever it is, you can contact them and say so and so that they have mailed my degree, kindly verify it. So that is all you can do from our side.
All right. Thank you.
Anytime.
Ma'am, if we complete our internship in India or if we leave completely our internship, then what difference it will make in AMC?
So after you complete your internship year, anyways, you won't be like, you'll be going for PG, right? Or nobody's gonna settle just for MBBS. So after you give your AMC, same, you can just work and then follow with your PG.
I'm trying to ask that if Indian internship makes any difference.
No, it doesn't make any difference. Like if you have work experience, that makes a difference. But internship, they don't count as experience.
Okay. Thank you.
Thank you.
Excuse me, ma'am.
Hi.
Yes, ma'am. After clearing this AMC1, will we directly get the job in Australia or we have to do something else? And ma'am, as I heard from the other sources, the salary per month, they were telling me it was around like 10 lakhs or more. Can you please put light on it once again?
Okay. So what I said is like everybody just do their marketing gimmick. So they might have said that, but the truth is nobody is gonna get job in cities right away. So in cities, if you get, it is 10 lakhs per month, but nobody is gonna get posted in cities right away. They'll post us first in rural areas. In rural areas, the salary will be around like 55 lakh annually, which is like 1 lakh or 1 lakh 20 AUD, 1 lakh 20,000 AUD or something. So with experience, maybe after a year or so, then they'll post you in the cities and then your salary increases. Nobody is gonna give you right away in the main cities.
Okay, ma'am. Thank you.
Thank you.
Ma'am, in English exam, we have to pass IELTS or any other exam.
You can either give IELTS, OET, anything. And you can follow our Instagram pages. We have already posted regarding this. Either my account, Hema Priya Srinivasalu, or the Veritas School of Medicine. We have already posted regarding this on our Insta IDs.
Ma'am, I also have another question. Do we need to have the graduation certificate for applying for AMC, or can we apply or have the ECFMG verification before graduation?
You can apply for ECFMG before graduation, but when you give your AMC and all, you have to be graduated. You can't give exam before graduation.
Okay.
Okay, guys. I think are we done? Are there any more questions? Okay, I'll just quickly scroll through the comments. Okay.
Ma'am, if we get the job after AMC1, so what will be our designation?
We will be posted as a resident medical officer.
Okay, okay. Thank you.
No problem. So regarding course fees, you have to text a support group. Will you be able to prepare while doing internship? Yes, why not? If you take internship, it's around 1 year, right? In that, around 6 months only will be hectic posting. Another 6 months will be chill, minor posting. So that postings you can study. You mentioned step 1 and step 2, so AMC is required before applying for AMC. No. Step 1 and step 2 is like AMC step 1 and AMC step 2. I was not talking about USMLE step 1 and USMLE step 2. I was talking about AMC step 1 and AMC step 2. The course fees is valid only for 3 months of coaching or more. No, it's valid for 5 months and more also. What are the steps after passing AMC1? So this session is only regarding AMC1. So I think we'll stick to that now. What should be approach? Yeah, we can start practicing after AMC1. And FMG isn't necessary. And how much time gap is there AMC1 and AMC2? There's no time gap. AMC1 license is valid lifelong. After passing AMC1, how much chances to get job? It depends on your CV. And also luck. And also your hard work and consistency. If you keep trying, the universe will manifest for us, so we'll get it. The salary, I've already talked about it. And also this video will be recorded on YouTube and it will be posted there. If any of your friends or someone missed it, you can ask them to see over there. Tell about notes, we will get PDF or something, or we have to note down. No. Notes and all will be, you'll be provided with PDF. And also we are planning to make a printed notebooks available also. Ma'am, the salary after passing is more. You just told, can you please? Regarding the salary, I told you. And it would be, of course, more only, but not on your very first job. And I think it's better to land on your first job first and then you can try to improve your salary. As experience increases, salary also increases. Can you share course details? Course details will be support group. And then what is the course fee support group? You can kindly text to the support group and this PDF will be shared on the Veritas School of Medicine WhatsApp channel and also on our Instagram. Ma'am, I have not even started my preparation. I have doubt that what are main subjects, how to start and everything. For all this, you can, if you have doubt or if you have self-doubt, it's better to take a coaching. So that you'll have a little confidence and all. Course fees, you do job along. AMC2 is not required to get a job. You can directly get after AMC1. But the chances of getting job after AMC2 is little bit higher. And is there a time limit within much time we have to give AMC2 after AMC1? No, there's no such time limit. It's lifelong valid. Yeah, you can do PG after AMC exam. And Shekhar Reddy, AMC1. No, that's not true. It's lifelong valid. You can give it anytime. And how much cost is, just notes and not classes. We are saying that that all these questions should be to our support group. And if you want, you can take a screenshot of it and contact them. And this is my WhatsApp number. Here also you can contact me. If you have any academic or simply just about the course or any personal queries, I'll try to reply. And This is for the course. And this PDF again, it will be shared. You don't have to text me regarding this PDF share, that will be shared. Okay, guys. Thank you so much. And thank you for joining my session. Have a very good night. Happy night. Bye bye.
Thank you, ma'am.
Thank you. Bye bye. Good night.
Good night, ma'am.
Good night.
Good morning.